All right, let's talk about the ICU, the intensive care unit. This is a place where everything, and I mean everything, is governed by a strict set of rules. Why? Because it's literally a matter of life and death. So let's dive right in.
Just think about it for a second. An environment where the margin for error is basically zero. We're talking razor thin. A patient's vital signs can change in a heartbeat, and the team's response has to be just as quick. This goes way beyond just medicine. It's about intense, coordinated action, all under unbelievable pressure.
So that brings us to the big question, right? What are these rules? What's the playbook that separates a patient's recovery from a full-blown crisis? We're going to break it all down, the essential do's and the absolute critical don'ts that guide every single move in the ICU. And trust me, these aren't just suggestions, they're what keep people alive.
Okay, so first up, let's look at the positives. These are the proactive, life-saving protocols, kind of like the golden rules of the ICU. They're the foundation of everything. You know, in a room full of patients who are already incredibly vulnerable, some of the biggest dangers are the ones you can't even see. I'm talking about infections. And that's why the #1 rule, the principle that everything else is built on, is stopping an infection before it has a chance to even begin. And it all starts with something that sounds so simple, right? Hand hygiene. But we're talking strict hand hygiene, washing before and after every single time you interact with a patient. And then there's what's called aseptic technique. This basically means creating a totally sterile, germ-free bubble for any procedure, whether it's putting in an IV or just changing a dressing. It is absolutely non-negotiable. It's a ritual, and it's what stops those devastating infections. So once you've got that safety baseline down, the next golden rule is vigilance. And I don't just mean passively watching a monitor. No, this is an active, relentless state of being on high alert, always ready. So what does vigilance actually look like? Well, it means tracking every single vital sign, heart rate, blood pressure, you name it. But the key part is acting the moment something looks off. It also means treating all that equipment, the ventilators, the IV lines, like it's part of the patient. You're constantly checking for leaks, disconnections, any little thing that could go wrong.
And sometimes all that vigilance boils down to a single number, 2. Every 2 hours, a patient has to be repositioned. It might sound like a small thing, but that one simple action prevents these awful pressure ulcers. And those aren't just painful. They can actually open the door to a major infection, which is the last thing a patient needs.
Here's another great example. For a patient on a ventilator, just elevating the head of their bed, we're talking 30 to 45 degrees, can prevent a life-threatening type of pneumonia. See? These aren't just about making someone comfortable, they're direct, life-saving moves. All right, so we've covered the do's. Now we have to flip the coin and talk about the don'ts. And these are the big ones. The unforgivable mistakes. The kind of errors where one tiny slip-up can lead to total disaster.
First up, alarms. You know all that beeping you hear in medical dramas? Well, in a real ICU, that is not background noise. The biggest mistake you can make is to think of it as annoying. The rule is ironclad. An alarm is a call to action. You never, ever silence one without figuring out what caused it first. It could be signaling something catastrophic.
Okay, remember how we talked about aseptic technique as a do? Well, the don't part is even more serious. Think of that sterile area as a protective shield. If you break it, even for a split second with an accidental touch, you can unleash a nasty infection right into the patient. There's just no such thing as a minor mistake here.
Next up is a really important one, speed versus haste. They sound similar, but in the ICU, they are worlds apart. Haste is the enemy. It's about rushing. Precision is what saves lives. Every single medication needs to be double-checked, the right drug, the right dose, the right way. When you rush, that's when terrible mistakes are made.
You know, some of the most dangerous mistakes don't even happen at the patient's bedside. They happen on a computer or a piece of paper. I'm talking about documentation. If you forget to log a change in vital signs or a new medication you gave, you literally break the chain of care. It's a huge safety risk for the patient and has major legal consequences too.
And that brings us to the team itself. ICU care is a team sport, period. It is never a solo performance. The biggest don't is trying to go it alone. You have to have crystal clear handovers when shifts change, and you absolutely have to ask for help when you're in a tough spot. Trying to be a hero, that's a risk a patient should never ever have to face.
And finally, there are the mistakes that really hit the human connection.
Things like moving a patient without making sure every single tube and line is supported, or ignoring a family that's desperate for information, or just forgetting about a patient's basic dignity. These aren't just small slip-ups. They make an already traumatic experience so much worse.
So, we've gone through the do's and the don'ts. But if you take a step back and look at all of them together, you realize it's more than just a list of rules. It's a whole philosophy of care, a philosophy of healing.
So, what is ICU care at its core? It's really a blend of three things. First, that meticulous, almost obsessive attention to detail. Second, quick and decisive action. And third, right at the heart of it all, is compassionate, human-centered care.
Yeah, you can almost think of it like a formula, an equation, and you need all three parts. Attention to detail without quick action, useless. Quick action without compassion, that's just robotic. All three have to be working together, perfectly in sync. And that really brings us full circle, back to the human side of things. This philosophy shows up in even the smallest actions, like talking to a patient even if they're unconscious. It's about providing reassurance, sure, but more than that, it's about honoring their dignity as a human being, not just a collection of beeping monitors.
So in the end, yeah, the do's and don'ts are the roadmap. They're what keep people safe. They make the care effective. But as we've seen, real, true care, that comes from somewhere deeper. So it leaves you with a final thought, doesn't it? What is that special human element that takes a cold, hard set of rules and turns it into a true act of healing?